Did you know that 1 in 3 people will face a cancer diagnosis in their lifetime? But here's the good news. Early detection can save lives. Hi everyone, I'm Dr. Memet Isik, and welcome to Holistic Cancer Care, where we empower you with the knowledge to take control of your health through a blend of conventional medicine and natural supportive therapies. Today, we're talking about something that could literally change your life or the life of someone you love. Early signs and symptoms of cancer that you shouldn't ignore. Whether you're here to learn for yourself, a loved one, or simply to stay informed, this video will give you the tools to recognize potential warning signs and take action. Remember, knowledge is power, and catching cancer early can make all the difference. So, let's get started because your health is worth it. Our first symptom is one that might seem positive at first, but don't be fooled. We're talking about unexplained weight loss. If you're suddenly losing weight without changing your diet or exercise routine, it's a red flag. A significant drop, say 10 pounds or more, that seems to happen out of the blue. Cancers of the pancreas, stomach, esophagus, or lung can all lead to this type of weight loss. Your body is like a well-oiled machine. When cancer enters the picture, it throws a wrench into the works. Not every instance of unexplained weight loss means cancer. There could be other underlying causes, like thyroid issues or hormonal imbalances. If you notice the number on the scale steadily decreasing, without any effort on your part, talk to your doctor. Let's talk about another symptom that can creep up on you: persistent fatigue. We all have days when we feel tired, but if you're constantly feeling drained, it's time to pay attention. This isn't your run-of-the-mill tiredness. This is fatigue that lingers, that doesn't fade, even after a good night's sleep. This type of fatigue is a common symptom of cancers like leukemia, colon cancer, and stomach cancer. Cancer cells require an immense amount of energy to grow and spread, and they steal that energy from your body's resources. Fatigue can also be a symptom of other conditions. It could be a sign of vitamin deficiencies, anemia, or even depression. If you're experiencing persistent fatigue, don't try to push through it. Don't brush it off as simply being too busy or getting older. Talk to your doctor. Our skin is the largest organ in our body, and it's often a reflection of our inner health. Pay attention to any changes in your skin, no matter how small they may seem. I'm talking about changes that are new, unusual, or concerning. Think about the moles on your body. Have you noticed any new ones popping up, or existing moles that seem to be changing shape, size, or color? These can be warning signs of skin cancer. Skin changes can also be indicative of other types of cancer. For instance, a yellowish tinge to your skin or the whites of your eyes, known as jaundice, can be a sign of liver or pancreatic cancer. Next time you're showering or getting dressed, take a few extra minutes to look over your skin. If you notice anything new, unusual, or concerning, don't hesitate to make an appointment with a dermatologist or your primary care physician. They can examine your skin and provide you with the appropriate treatment and peace of mind. Persistent pain. Pain is something we all experience at some point in our lives, but what about pain that lingers, that doesn't seem to have a clear cause and just won't quit? This is persistent pain, and it's a symptom you should never ignore. Think of pain as your body's alarm system. It's a way for your body to tell you that something is wrong and needs attention. For instance, ongoing headaches that are severe, persistent, or different from your usual headaches can be a sign of a brain tumor. Similarly, back pain that's not related to an injury or strain could be a sign of ovarian or colorectal cancer. Bone pain can be a sign of cancers that have spread to the bones. If you're experiencing persistent pain, don't suffer in silence. Talk to your doctor. Changes in bowel or bladder habits. Let's talk about a topic that might feel a little uncomfortable, but it's crucial for your health. Changes in your bowel or bladder habits. These changes can sometimes be early warning signs of certain cancers. Think about your bowel movements. Have you noticed any significant changes in frequency, consistency, or appearance? Are you experiencing diarrhea or constipation that just won't quit? Or perhaps you've seen blood in your stool, which can be a sign of colorectal cancer. Now let's move on to your bladder habits. Are you suddenly feeling the urge to urinate more frequently, even if you haven't been drinking more fluids? These changes can be signs of bladder or prostate cancer. If you're experiencing any unusual or persistent changes in your bowel or bladder habits, don't hesitate to talk to your doctor. Unusual bleeding. Bleeding is a natural part of life, but what about bleeding that seems to come out of nowhere that's not related to any injury or normal bodily function? This is unusual bleeding, and it's a symptom that should never be ignored. Imagine coughing and suddenly tasting blood in your mouth, or discovering blood in your stool after a bowel movement, or noticing unusual vaginal bleeding between periods or after menopause. These are all examples of unusual bleeding, and they can be signs of various types of cancer. For instance, coughing up blood can be a sign of lung cancer. Blood in the stool can indicate colorectal cancer. If you're experiencing unusual bleeding, don't panic. Contact your doctor as soon as possible. Lumps or thickening. Our bodies are amazing, intricate systems, but sometimes things go awry. And one of the ways our bodies alert us to potential problems is through the appearance of lumps or thickening. I'm talking about persistent lumps or areas of thickening that weren't there before, especially in areas like the breasts, testicles, or lymph nodes. Imagine feeling a lump in your breast during a self-exam, or noticing a thickening in your testicle while showering. Early detection is key when it comes to cancer, and lumps or thickening can sometimes be the first noticeable signs. By catching these changes early, we have a better chance of successful treatment and recovery. We've all experienced the occasional cough or hoarse voice, especially during cold and flu season. But what about a cough that lingers for weeks or even months, long after the sniffles have subsided, or hoarseness that just won't quit even after resting your voice? These persistent symptoms can sometimes be red flags for more serious conditions, including cancer. Imagine a cough that's not just annoying, but also produces phlegm that's tinged with blood, or hoarseness that makes it difficult to speak or swallow. A persistent cough, especially one accompanied by blood, can be a sign of lung cancer, and hoarseness that lasts for more than a few weeks can indicate throat or laryngeal cancer. If you're experiencing a persistent cough or hoarseness, don't wait for it to go away on its own. Talk to your doctor. Swallowing might seem like a simple automatic process, but it's actually a complex series of coordinated movements involving muscles in your mouth, throat, and esophagus. And when this process is disrupted, it can be a sign of a more serious underlying condition, including cancer. Imagine sitting down to a meal, only to find that you're struggling to swallow your food, or feeling like food is getting stuck in your throat or chest. This sensation, known as dysphagia, can be a sign of esophageal or throat cancer. If you're experiencing persistent or worsening difficulty swallowing, it's crucial to get it checked out by a doctor. Early detection is key when it comes to cancer, and difficulty swallowing can sometimes be an early warning sign. We've all woken up in the middle of the night feeling a bit warm, maybe because the blankets were piled too high or the room was stuffy. But what about night sweats that drench your sheets, leaving you feeling clammy and chilled? Or a fever that spikes without any obvious cause, like a cold or flu? These symptoms can also be red flags for more serious conditions, including cancer. Imagine waking up in a pool of sweat, your pajamas soaked through, even though the room is cool, or feeling feverish and achy, but without any other signs of infection. Persistent night sweats or a fever that won't quit can sometimes be signs of cancers like lymphoma or leukemia. If you're experiencing unexplained night sweats or fever, don't dismiss them as nothing. Talk to your doctor. They can evaluate your symptoms and determine the best course of action. Remember, your health is your greatest asset. Pay attention to your body and don't hesitate to seek medical advice if something feels off. If you found this video helpful, please give it a thumbs up. Share it with someone who might benefit, and subscribe to our channel for more health-related content. Thanks for watching, and take care of yourself.